So how common is colon cancer in this country?
Colon cancer is the third most common form of cancer in this country when you exclude skin cancers, and it's the second leading cause of cancer death for men and women in this country.
Is there any difference with Iowa?
Iowa actually has one of the highest rates of colon cancer in the nation, so each year there are approximately 2,000 new cases diagnosed in Iowa and 600 colon cancer deaths in Iowa.
Is there any reason for that, do you think?
It probably to some extent reflects the Midwestern diet and tendency toward obesity and possibly some genetic factors, but nobody really knows the answer.
So what are polyps?
Polyps are fleshy growths that occur in the colon, and some polyps, perhaps half, have the potential to become bigger and over time become malignant, become colon cancers. So colon polyps, while they don't all have that potential, they are the precursor lesion to colon cancer, and that's why we worry about colon polyps and we endeavor to remove them.
So how are they formed?
Nobody really knows why people develop colon polyps. Certainly they can run in families, they'll have a familial predisposition. There may be environmental and dietary factors. Risk for polyps and colon cancer includes obesity, tobacco, excessive alcohol, and genetics.
Are there warning signs or symptoms of colon cancer?
There are rectal bleeding, a change in bowel habits, abdominal pain, unexplained weight loss can all be signs of colon cancer, but probably the number one symptom of colon cancer is the absence of symptoms, and that's why screening is so important.
So is it really like father, like son? So how much more at risk is someone if their father or grandfather had it?
Well, if you have a close relative with colon cancer, particularly onset before age 60 or 70, it probably does double your risk. So we're not talking so much about grandparents as parents and siblings or even children. That being said, 75% of patients with colon cancer do not have a relative with colon cancer.
And what is the diagnosis percentage of male versus female?
Men do have a slightly higher risk for colon cancer and colon polyps. So the lifetime risk for men is approximately 5.5%. For women, it's 5.1%. But since women live longer, the absolute number of cases ends up being about the same.
So why should someone look at doing a colonoscopy, and at what age should they consider?
Colonoscopy is very important because, as I alluded to, most colon cancers are going to start out as small colon polyps first, and if we remove those polyps, we can prevent many colon cancers from developing. And there's actually a 5 to 10 year window for most precancerous polyps before they would become a colon cancer. There are a small percentage of colon polyps that are very aggressive and very rapidly go from a small polyp to a cancer, but those are more the exception than the rule. And the reason to go through colonoscopy is studies have shown that there may be up to a 77% reduction in the incidence and mortality from colon cancer in people who have been screened with colonoscopy and removal of colon polyps. And that degree of protection actually lasted for 10 years or more. So additional studies have shown that up to 14,000 deaths from colon cancer are in fact prevented each year by performing colonoscopy. But the sad part is that up to 20,000 people a year are dying from colon cancer that didn't need to if they simply had had a screening exam of the colon. So typically, if you have no symptoms and no familial risk for colon cancer, we start at age 50. And that's because more than 90% of colon cancers arise in people age 50 and older. If you do have a close relative with colon cancer, particularly onset before age 60 or 70, you should strongly consider having a colonoscopy at age 40 instead of waiting till age 50. And certainly if you have signs or symptoms like a change in bowel habits or rectal bleeding, colonoscopy may be appropriate at any age.
And what do you need to do to prepare for a colonoscopy?
That's the tough one. Unfortunately, it's not a walk in the park. We need to have an extremely clean colon or we're going to miss lesions. And Typically it involves a liquid diet and bowel prep, which is a laxative prep. Some people, if they have a tendency toward looser stools or more frequent stools, may get by with a lesser volume of prep. People with a tendency toward constipation or people who have a lot of diverticular disease really need to drink a gallon of laxative. And I know this is the part that people hate, and even some people avoid the procedure because of it. But quite honestly, if you want to prevent colon cancer, you want the best exam possible. You don't want a doctor missing a polyp or a small tumor because he can't see through the stool.
Mm-hmm. So how much pain would someone encounter during the colonoscopy?
Typically, it's a painless procedure. We give intravenous sedation for it. People are typically asleep, at least during the insertion part of the procedure, and maybe starting to wake up as the instrument's withdrawn. The average person, it's a pain-free experience. Some people, if they have a very low threshold for pain, or if they're on a lot of chronic medications that interfere with sedation, may have discomfort, but that's actually really rare.
So are there preventative measures such as medications or diet that can help you lower your risk?
That's a good question. People have looked at a lot of different things, and there certainly are lifestyle modifications that will decrease the risk for precancerous polyps as well as colon cancer. A diet that's low in red meat or animal fat will decrease your risk. If you're a smoker, quitting tobacco is important. Excessive alcohol use also should be curtailed. Exercise also may decrease the risk for colon cancer.
Are there any preconceived ideas or false information that's out there right now on colon cancer?
Well, I think as I alluded to before, I think some people have the perception that, well, I'm a woman, I don't have to worry, only men get colon cancer. As I said, the lifetime numbers end up being about the same for both sexes. The idea that it's a death sentence, I think, is very incorrect. We have the unique opportunity to intervene by removing precancerous polyps, first of all. We can probably prevent 80 or 90% of all colon cancers by removing precancerous polyps. And that's very important. A lot of cancers aren't like that. For example, breast cancer starts out as a small cancer. It doesn't start out as a benign lesion. So we really have years in which to intervene in order to prevent most colon cancer. The other issue is chemotherapy has made tremendous strides, and there are a lot of people now who are being cured of colon cancer who, when I graduated 20 years ago, it was a death sentence. And in addition, even people with advanced colon cancer are living 10 or 15 years with stable disease and enjoying time with their family and being productive.